So here at Spear, instead of starting the way we used to with Frank's setting the central incisor, today we start with Airway. But Airway isn't about doing a pulse oximetry or a sleep study. It's about figuring out where the skeleton should be and where the dentoalveolar housing should be. And we have that information. Bill Arnett yesterday did a beautiful job of sharing it. We've had it for a very long time. We just haven't taken advantage of it the way we should. We work from a model called Airway-Directed or Airway-Aware. Airway-Directed is the old way, what I introduced in 2016, which is in order to do something, I need to know how sick you are. I don't need to know that anymore. Remember what Arnett said yesterday? If you put the face where it's supposed to be, the apnea takes care of itself. That's what we do today. We look at the anatomy. We call it Airway-Aware. And we say the anatomy is off, we're going to make it better, and we're going to provide options before we simply put on veneers. So when you see this patient, think to yourself not about the dentistry immediately, but about the fact that they are sick. The literature is replete with evidence that says these people are sick if they have malocclusions. Got to make them better. And in fact, the medical literature agrees with us. Here's the funny part. Physicians say crowded, narrow, or inherently collapsible upper airway is the key cause of apnea. Then they give us exactly the answer that I want, which is, what do you do about that? You reverse the anatomy. Here's the big flaw. They don't know how to reverse the anatomy. Their answer for reversing anatomy is put them on CPAP, give them an appliance, or cut out some tissue, none of which reverse the anatomy. What we should be doing is what? Dentistry. It's easy. So let me give you a great example. This young mouth breather is me. And so I feel like Frank right now, showing you baby pictures. But yeah, I grew up a mouth breather for the better part of 50 years. This, and there will be no comments about the porn mustache later, please. This is me in dental school getting an evaluation. But you don't need any sleep information, do you, to look at me and go, the anatomy's off. The teeth are in the wrong place, the smile is all messed up, the teeth are too small, and the bite is horrible, yes? So, could you offer me an option to become healthy? And in fact, Tracy Nguyen told us yesterday, we have numbers now, how wide, how far forward in order to be healthy. You could put together a treatment plan to make that happen. But what do? We do veneers, and that's what I did. And for 10 years, I lived with 6 veneers, and then I added more veneers, and I lived for another, 16 years with those. But all in all, I knew I was unhealthy. I knew I needed to make a change because I was studying it by now. And so, luckily for me, I had a path that I could follow, but I started with the easy solution, which is sleep dentistry, right? Let's not cut off the veneers and do all that. I did a sleep study. I became a vegan, which was the worst mistake in my life. Cost me my friends and family. Horrible, horrible mistake. Made a night guard or a sleep appliance. They're nasty after wearing them a while. And I said, finally, if I could turn myself into that, I could be healthy and not wear it. So that's what I did. I found the best in the business. I found Rick Robley. Y'all got to see him do cases the other day. He did mine. Mike Curry is the surgeon. What is the first thing you have to do? You have to cut the veneers off and go backwards in time. Most people are not willing to do that. That's why you don't put the veneers on at the very beginning. We go in and do SFOT surgery. MARPE was not available. Custom MARPE was not available at this point in time. I would have probably done it that way in hindsight, but SFOT is what we had available at that moment. We made the cuts, did the surgery. This is what happens if you don't listen to the surgeon and you don't take the medications correctly. You can take steroids for the first week. It's fine, right? So we're going along and moving the teeth. I go out to a lecture in North Carolina at the end of the wrap effect, which is when the teeth are really moving quickly. The guy in North Carolina looks at me and says, hey, you look like you could be from here. I went quickly back to Arkansas and said, Rick, we got to do it again. So we did a second surgery because we needed to get more. We needed to get the tip corrected and the torque corrected in the teeth. That's how much you swell if you're done. By the way, 2 surgeries, total of 3 Advil. That's all it took, okay? That's how much expansion we got. We needed the diastemas in the anterior because my teeth are very narrow. I have a Bolton's discrepancy that needed to be corrected. That worked to my advantage of keeping the width. I went back to Rick and he said, "You look good." And I went, "You're from Arkansas, of course you said that." But we then got Bob to put some veneers on the teeth, and we started completing the resolution of my case. So that's my final arch form with the beautiful veneers that Bob did for me on those teeth, showing you the correction of the anatomy. He calls it my sexy smile, and I agree. I think they're great. The dentistry is wonderful, but could I have ever had that look if I hadn't gone through the expansion? And the answer is no. You simply can't make that type of bite and function happen unless you go through something. But even more so, could I have this, an apnea level of 1, if I didn't go through it? And the answer is no, you can't. So, are you willing to start looking at your patients differently and go beyond structural and biologic issues and start looking at the whole person and start trying to bring your dentistry into what we're practicing today, a more health-based type of care?